maybe different potencies, different sequence. Maybe there will be a difference in 2-3 remedies plus or minus per treatment. But the principle the same, because we're dealing systemic intoxications and we're dealing systemic infections, and we take into consideration the whole host of environmental and other lifestyle factors that either work against them or for. Okay, next one. It's just the patient who had, a multiple severe health problems, from pain to fatigue to depression to pretty much list like I just showed you with this patient. And I don't know whether that patient was or was not diagnosed prior with Lyme, but I told you the majority of Lyme disease you will find in patients where this diagnosis was missed. So the Lyme disease, by the way, has now been reaching epidemic proportions, and I think this epidemic is far greater and ominous than even official statistics report. Basically, they report that every year there is a continuous rise in the incidence of Lyme disease here and in Europe. But however, due to limitations of conventional blood tests, I think the true incidence is much higher. All right, so this patient that had many problems, including history of squamous cell carcinoma, I believe of the skin, was diagnosed by me when I saw the patient first time, among other things with Lyme disease. So, but again, we started with the patient had also a high number of mercury fillings, so the entire body was intoxicated with mercury, from bone marrow, supportive apparatus, thyroid. She also had pesticides in the liver, mercury in the liver, kidney. Then large intestine. These are worms. Worm infection, brain. There was also a history of head trauma in the past, and the test did register this as well. I believe the patient sustained severe brain concussion in the past. Natrium sulfuricum, among few remedies, which is a primary remedy for brain trauma, brain concussion, was given to her, the classical remedy. Then also Lyme was found to be in the brain and in the body. Then small intestine support was offered, emotional center, hippocampus, head. Next. Frontal lobe, breast, also found diesel oil, and the patient did confirm exposure to diesel, to diesel fuel. I think there was a history of diesel fuel being used either in the farm or around the residence where the patient lived. Lymph, antibiotics, HPV virus, cervix. And then again, repeat